Clearstep was founded because healthcare is pretty difficult to navigate. And as soon as I started medical school, my friends and family started asking what they should do for their symptoms. I have a background in engineering as well, and rather than focusing on the answer to their problems, I actually thought about, why are they asking me? Don't we live in the information age? Shouldn't there be easy, convenient answers for everyday people to figure out what to do for their care? Not everybody has access to a healthcare provider and their friends or family network. And at the same time, when going through medical school, realized that the questions that we ask in clinics to triage a fever or a stomach ache or a sore throat are pretty algorithmic and almost robotic in nature. So my co-founder and I, when discussing this problem, realized that there aren't good solutions out there to help everyday people and patients navigate through their care. And when they go to a health system website, oftentimes it's convoluted. They don't know where to go for their care. They don't know what type of care they need. So we created a system to automate the whole care navigation process in a clinically intelligent and accurate way that health systems could rely on and trust to help everyday people navigate their care in a more easy and intuitive way. From my perspective, an ideal end-to-end patient-consumer journey should kind of replicate the experiences that we've come to rely on and trust and love in all sorts of industries, whether it's transportation or shopping or even dating, where the whole end-to-end experience is frictionless, user-friendly, price transparent, and really handholds the individual through a complex navigational and buying process that otherwise may require domain expertise, but can be democratized, decentralized, so that everyday people have an easy way of navigating through their care. So in more concrete terms, if you have a new symptom, you should be able to go through an experience that asks you 10 or 15 easy multiple choice questions similar to what a doctor would ask, get to the end of that, and then be surfaced options that match you to the clinically best sites of care for those specific symptoms, your specific conditions that are within your network, that are ideally price transparent, allow you to shop around, book your care conveniently according to your terms. And then once that care has been sought after and completed, given opportunities to rebook the next follow-up visits conveniently, texted to you, and kind of be handheld through the whole process, eliminating the need to find and search for your own doctors without really knowing what to look for, and made as easy as possible for everyday people. There's a number of indications that the US healthcare system has access and care routing problems. A couple studies have been done on this. The National Academy of Medicine published a report that about $750 billion of US healthcare spend every year is wasted or inefficient. On the other hand, I think the Annals of Internal Medicine published a study that up to 70% of ER utilization was unnecessary, and about half of that could have been handled at a primary care setting. So these are two kind of metrics or indicators that healthcare usage in the US is inappropriate, that patients are inappropriately routing to ERs or other sites of care. And we really saw this come to a head during the COVID pandemic, when solutions like Clearstep focused on care routing suddenly achieved over 50 times more adoption across the healthcare system, when healthcare routing was a top problem for the US system to solve, and since then have continued to see this need throughout the healthcare ecosystem. Some of the top indications for the need of outpatient capacity management, better outpatient capacity management, can be found in some studies that Clearstep has done. We have looked into, with our partner Tufts Medicine, the sorts of patients that their specialists and primary care providers are seeing, and did an analysis to find that about 30 to 60% of patients across the board of all their specialists and primary care providers, that those patients were inappropriately being seen and could have, or maybe even should have been seen by a advanced practice provider, some virtual option, or a less specialized method of care where that patient could have led to a more available open slot for a higher complex or a patient that was more appropriate for that provider. This sort of problem at the individual provider level expands out into a much bigger problem across the healthcare industry, leading to all of the sort of burnout issues that we're hearing of today, the decreasing margins on the healthcare system side, and leading to a number of issues, including hospital closures across the ecosystem. And many health systems are even close to bankruptcy or quickly losing money and operating at negative margins as a result of inappropriate use or inappropriate filling of the capacity of their providers. If outpatient capacity was better managed across health systems, then providers would be seeing patients that were more relevant to them. They would be generating more revenue from these visits, and patients would be less bounced around from provider to provider. So overall, margins would increase, overall dollars to the system would increase, providers would be seeing patients that were more within their wheelhouse, and patients would have a better overall experience making sure that their issues were being handled and addressed, resolved more immediately without having to be bounced around. We've all been through this, having to wait hours or being bounced from one provider to the next over and over. So if there was a solution out there to help ensure better routing and management of provider capacity, then it would benefit everybody. Health systems can better manage their current outpatient capacity management with technology, particularly technology solutions that better validate or qualify patients for individual providers or provider types. Many systems these days are adopting online scheduling systems, but there are not sophisticated methods to ensure that the patients that are booking with those providers are in fact the right patients. So having some sort of qualification system, triage system, digital tool or engagement technology as embedded in the front door as part of either the booking intake process to make sure that those patients are appropriate for that type of provider would ensure on the front end that capacity is better being managed. And then also partnering up with telemedicine and virtual options to better redirect patients that would otherwise fill slots to appointments options that are virtual or with APPs may help create better capacity for those more specialized providers that could serve to address patient needs that are more complex. Clearstep's partnering with health systems to improve care access, routing, and capacity management problems in a variety of ways. At present, we are the market-leading solution for digital self-triage across the healthcare industry because we have the most clinically validated protocols derived from the co-author of the same protocols used in every call center in the country and validated in hundreds of millions of encounters, but also due to the fact that over the 5 years of our adoption in the industry, we have the largest scale deployments across the health system space. And because we're handling tens of thousands of triage encounters every week, Clearstep is trusted and relied upon to route patients and provide better access to the appropriate care types. As a result of our market dominance in the virtual triage space on the front end, we've now begun to make headway into some of the more sophisticated capacity optimization spaces. For example, with our partner Tufts Medicine, we are now creating a holistic solution to make sure that we're not only routing people to the right places within the system, but those patients that may be better served by a virtual option or an advanced practice provider are redirected to those and opening up slots for providers that are more specialized and filling those slots with patients that need more complex care, have a more nuanced set of needs, and we also calculate are likely to bring in more RVUs for those individual providers. At the same time, making sure that we have sophisticated mechanisms in place to ensure that providers are also having their preferences met. Some providers like to have slots or spaces in between their complex patients as a sort of break or to give them some breathing room. We can make sure that those filtration criteria are part of the system so that we're not just filling blindly with high RVU, high revenue generating, highly complex patients, but we're also giving them a control over their schedules while addressing the business needs and some of the other solving some of the problems that the health system has themselves. During Clearstep's product development, there were a couple of key challenges that we faced. Number one was creating a system that could be trusted by healthcare organizations to automatically route all their patients agnostic of various levels of clinical needs. How do we know that we are routing patients with chest pain appropriately? When evaluating the approaches to building a more automated system for digital self-triage, there were a number of technologies or methodologies available to us. We could go after the more black box AI systems that many of our competitors use, but those don't give a sense of what the exact criteria were to routing X patient to Y place, and didn't give an ability to fine tune and in a validated way in case there were changes that needed to be made. On the flip side, we also know that over the millennia of human clinical advancement, humans have figured out what the appropriate rules are for decision making and routing patients to the right places. So we partnered up with the same co-author of the telephone triage protocols used in every call center of the country and transformed all of that for digital self-triage. But along the way in our product development, realized that software engineers and doctors speak two highly technical languages and aren't trained to interact with each other. So what we had to do was solve for that. How could we transform all of these gold standards decision rules, but do it in a way that didn't require clinicians and our product owners to have to learn how to code or become software engineers. So we created a system that allowed them to create algorithms and point and click without turn into all those algorithms into code without having to learn any coding themselves. And then once we had encoded the knowledge graph of a whole panel of emergency medicine, family medicine, internal med providers into a sophisticated reconciled knowledge graph for about 500 different chief complaints, pretty much everything that patients search into our search bars, then we could start doing sophisticated machine learning on top of that, layering in natural language processing, conversational AI, generative AI in addition. So in that way, going from zero to the accuracy of an everyday provider by encoding the knowledge already within the heads of our providers, and then extending beyond that with sophisticated computational statistical methods, all on top of an already gold standard validated set of content trusted for decades in the nurse call centers across the country. There's a couple learnings in our journey that have shaped our growth and innovation. One of them is, how do we balance a slow-moving industry? And what I mean is health systems are large organizations with a complex array of stakeholders that really take their time to make decisions as to innovative technologies that they will adopt, while entrenched in a very rapidly adjusting market ecosystem climate. For example, COVID brought with it a whole array of new problems that required very fast movement. So how would we as a technology company create technology for larger, bigger organizations that may be slower moving, but still adapt those to a constantly changing set of problems in their mind? When COVID came around, what was top of mind was routing and making sure patients were going to the right sites of care or staying home when they didn't need to go into the system to try and contain the pandemic. So we made sure that our product really addressed needs and solved for issues related to routing. Whereas after the pandemic, or as the pandemic subsided, the top of mind needs became provider burnout or capacity management, capacity optimization. And our engines, our triage engines, are well suited to help patients navigate care, but also to better route capacity, better offload demand from the call centers. And so making sure that our pieces of technology, while broadly applicable, were matched to the problems that were top of mind and relevant to the current times, is how we make sure to, is one of the problems that we faced and have solved by taking a broadly applicable set of technology and fitting it to individual needs as the climates change quickly. We ensure interoperability at Clearstep with a variety of different platforms, devices, EMR systems in a number of ways. First off, we have a variety of levels of implementation, some that require no integration with existing systems, but still provide tremendous value in the ability to convert patients into bookable options for the systems and route them appropriately. Moving beyond that, we have a complex array of integrations already built for the variety of electronic medical records: Epic, Cerner, Athena, eClinicalWorks/Helo, CRMs like Salesforce, and provider directory management solutions and scheduling softwares like Kairos, Experian, Red Ventures, etc. The majority of what our system partners across the country use. In addition to all of that, we have a set of APIs that any other provider, vendor, health system partner can use to integrate into our various product modules. Clearstep protects privacy concerns and sensitive healthcare information in a number of ways, one of them being levels to our integration. Our lightweight early deployments involve unauthenticated experiences that don't require any information about the patient. In fact, we're able to route and navigate patients in a highly clinically intelligent way without needing to know who they are or identify them. As a result, the information that we're collecting is not PHI. But despite that, we make sure that all the information we collect is protected in a way that is high trust, ISO, and HIPAA compliant, and have SOC 2 certification as well, so that when we do integrate more in a deeper experience with our health system partners into the EMRs and actually pull information on patients to autofill or provide more delightful experiences to patients, all the information that we collect is encrypted in rest, encrypted in transit, and is only kept for the minimum amount of time needed to help that patient before we wipe it all. And most of the time, taking only what we need for the patient's routing. Again, making sure that if we don't need any information that's identifiable for the patient, we don't collect it and proceed with an unauthenticated experience, while making sure that everything that we collect is as secure as possible via our variety of security mechanisms available in our security white papers, such that if deeper integrated, it's safe and secure for our customers. And lastly, we ensure as a fallback to indemnify our customers against any sort of potential data leaks, cybersecurity issues, or other problems that may lead them liable with our own comprehensive insurance policies, which is a advantage to working with Clearstep as well. On the horizon for Clearstep's product roadmap are a couple of really sophisticated and exciting features. We have gained market leadership as the premier digital self-triage solution across about 15 different states and health systems across the country. And with that, are extending those features for deeper, more delightful features like diagnostics prediction. When we take in information on the patient's signs, symptoms, medical history, conditions that lead to a triage, we're also on the back end calculating what labs, tests, diagnostics will that provider need in a clinically relevant and accurate way, opening up to the ability to match patients to the facilities that have those resources, imaging, labs, tests, but also teeing up orders in the EMR and for documentation purposes. By calculating those diagnostics, we marry the predicted diagnostics down to the CPT bill codes and have a partnership with Change Healthcare where we are able to cross-reference the predicted diagnostics, therapeutics, labs, and tests needed for the patient with that individual patient's plan benefits, and to calculate for individual providers what the cost of care may be. So enabling the most sophisticated price prediction feature that the USA has ever seen, allowing patients to, before they go in for their episode of care, to estimate what that cost of care would look like from one provider to the next and shop around for their care and book that care according to the criteria that they may have along insurance, price, various other filtration criteria. In addition to that, as we build these really sophisticated features for navigation, doing some of the more detailed capacity optimization that I talked about before, and finally layering in generative AI with the recent large language models, such that as patients ask things in the Clearstep system on their health system websites, and when it's white labeled for our health system partners, if our triage engines are not able to navigate them to the right service or care need, and they're asking a more esoteric question related to their healthcare, we can still provide them actionable, useful information to support their decision making, leading us to the most intelligent central processing unit for care navigation, information support, and healthcare that the USA has ever seen, and are delighted to be bringing that to some of the largest health systems in the country today across the USA.